Good morning, dear students. Today we are discussing very interesting topic in the respiratory system, that is high altitude physiology. What happens to the body when we ascend high altitude? Now, when we this is nothing but the mountaineering, this is nothing but the trekking, and we all are very excited about doing the mountaineering and the trekking. But there are certain things which must be kept in the mind before starting the mountaineering and the trekking. That is, if you ascend rapidly the high altitude, the signs and abnormal signs and symptoms may develop. Now, why these signs and symptoms may develop? They may develop because as we go up, the atmospheric pressure is decreasing, the partial pressure of oxygen is also decreasing, and the temperature is also decreasing. Now you may say, sir, we have been to the high altitude but we never develop these signs and symptoms. Just imagine you have been to the Gulmarg in the Kashmir Valley, which is at the height of around 8,000 feet from the sea level, and at that height you may not develop the signs and symptoms. But if you go to the height of Leh and Ladakh, which is more than 10,000 feet, there you definitely develop the abnormal signs and symptoms. And these abnormal signs and symptoms, they start within hours and may take 1 to 2 days. So this is how these are the abnormal signs and symptoms develop, and they are developing mainly because of decrease in the partial pressure of oxygen. So then, what is the state of partial pressure of oxygen at various altitude? At sea level, the partial pressure of oxygen is 159 millimeter of mercury. Then at the height of 10,000 feet, the partial pressure of O2, it falls to 110 millimeter of mercury. Then at the height of 20,000 feet, partial pressure of O2 in the air, it falls to 70 millimeter of mercury. Then at the height of 30,000 feet, which is almost the height, slightly more than the height of Mount Everest, it is partial pressure of O2, in that atmosphere it is 43 millimeter of mercury. Now you can say that, sir, at the 20,000 feet, the partial pressure of O2 is 70 millimeter of mercury, and in our oxygen dissociation curve, we have seen that at 70 millimeter of mercury, the hemoglobin is far more saturated with more than 90% saturated with oxygen, so there may not be the chance of development of hypoxia. But still hypoxia is developing, and that is the moderate to severe hypoxia is developing at 20,000 feet. Why? This is because, just recall our oxygen transport at the sea level, partial pressure of O2 is 159 millimeter of mercury. But when that air is taken in, and by the time the air reaches the alveolus, the partial pressure of air in the alveolus, it is fallen to 104 millimeter of mercury. Same thing happens at the higher altitude. At the altitude of 10,000 feet, though the partial pressure of O2 in the air is 110 millimeter of mercury, the alveolar CO2 is only 67 millimeter of mercury. At 20,000 feet, partial pressure of O2 is 70, but alveolar partial pressure of O2 is 40 millimeter of mercury. And at 30,000 feet, where it is PO2 is 43 millimeter of mercury, by the time the air reaches the alveolus, PO2, it falls to only 18 millimeter of mercury. So from these values, it is very, very clear that up to 10,000 feet, we are having sufficient availability of oxygen into the air as well as into the alveolus. Because alveolar CO2 is 67 millimeter of mercury, and at 67 millimeter of mercury, hemoglobin is more than 90% saturated with the oxygen, so you can safely ascend to the height of 10,000 feet. But beyond 10,000 feet, there is sharp fall into the PO2, and you may develop the hypoxic effects. So what is the critical height for the ascent ascent? The critical height or the safe height, it is said to be 10,000 feet. Beyond that, that there is the development of what? Acute mountain sickness. What? Beyond the height of 10,000 feet, if you are going, there is the development of acute mountain sickness. So, what is this acute mountain sickness? Acute mountain sickness is developing when the ascender is ascending above the height of 10,000 feet. And he is ascending not only for the first time, and he is ascending rapidly because of the excitement and because of the enthusiasm. And what happens is that the first system that is affected, it is the central nervous system is affected, and the signs and symptoms they start developing. What is the first sign that is noticed? Because of decreased supply of oxygen to the muscles become tired. There is the tiredness. Then the second one is there is weakness also. Second one, there is the development of confusion. There is the development of headache. There is the development of irritability. Nausea may develop. Vomiting may develop. These are the signs and symptoms which may develop first when the person is ascending above the 10,000 feet. So, if these signs and symptoms which are abnormal, if they are ignored and the person is again going up and exposing the body to less partial pressure of O2 or to more hypoxic situation, then these severe problems of the brain may develop, and that leads to twitching of the muscle, or sometimes it may lead to convulsions. That convulsions may occur. Even if the person is allowed to go up, there may develop the coma and the person may die, and because of just the hypoxic situation. Now the question does arise, sir, initial signs and symptoms, that is confusion, irritability, headache, muscle weakness, they are okay. They are okay because they are okay to explain because they have been developing because of the less supply of oxygen to the tissue. But how this twitching, convulsions, coma, they are developing, and ultimately the death is occurring. What is the reason for that? The reason for that is that as we go up, the partial pressure of oxygen is decreasing. Because of decreasing the partial pressure of oxygen, since hypoxia is created, this is the arteriole. This arteriole, it undergoes dilatation. The diameter of arteriole, it is increased. Because of more diameter of the arteriole, more blood flows into the capillary. Hydrostatic pressure into the capillary is increased. There is more filtration of the plasma into the tissues of the brain, and there is the development of what? Edema. And as we go up, dilatation goes on increasing, filtration goes on increasing, and the severity of cerebral edema also goes on increasing. And remember that though there is a swelling of this brain is not having any convenient route to go through it, because it is already encased into the strong structure that is the cranial bones. And thus brain is swelling, and at the same time brain is getting pressed against the hard structure that is the cranial bones, and these are responsible for twitching, convulsions, coma, and finally the death. So cerebral edema is one of the important factors that is responsible for the death in the acute mountain sickness. Then, apart from the involvement of brain, one more organ is also affected, and that is nothing but the lung. What happens in the lung? There is a difficulty in the breathing. Why there is difficulty in the breathing when we are ascending up? The reason is this is the one alveolus, this is second alveolus, this is the artery, this is one arteriole, and this is another arteriole, giving rise to the pulmonary capillary, and this arteriole is giving rise to the separate pulmonary capillary. Now at high altitude, what the situation is, one alveolus is poorly ventilated and other alveolus is properly ventilated with the air. So what happens that the arteriole which is next to the alveolus, which is poorly ventilated, it undergoes vasoconstriction. Because of that, blood flow to this concerned capillary, it is decreased. But that blood is then diverted through the arteriole to to the alveolus which are ventilated properly. So more blood is diverted to the alveoli, capillaries of the alveoli who are ventilated properly. So more blood is accumulated, more filtration, and there is a development of what? Pulmonary edema. Pulmonary edema is not a uniform edema, it is a patchy edema that is present, and that is responsible for the difficulty in the breathing. So here we are saying that hypoxia, hypoxia is leading to what is called the vasodilatation, and here we are saying that hypoxia is leading to vasoconstriction. Why it is leading to vasoconstriction into the lung, this is not known. Till now it is not known. The thing is that the blood flow to the poorly ventilated alveolus, it is decreased, it is compromised, and that remaining blood is then diverted to the alveoli which are properly ventilated. And because of that, the alveoli which are properly ventilated, they may develop the edema. So these are the pathological changes that occur when in the acute mountain sickness. Now the next thing is, sir, if it is developed, then what is to be done? All the things they are developing because of lack of O2. Give oxygen to the affected person, and if available, give one diuretic. Name of that diuretic is the acetazolamide. This diuretic will cause loss of water from the body, and then it will relieve the edema of the cerebrum and the edema of the lung. Even if the person is not treated properly, it is better to take the person at the sea level or at the ground level and give the treatment. So this is about the acute mountain sickness. This acute mountain sickness, it is more common in the first time ascender and the ascenders who are ascending rapidly. Second question you may put in that, sir, is it possible to avoid the development of acute mountain sickness? Yes, very well. What steps to be followed? Ascend slowly, take rest, ascend slowly, take rest, and thus allow your body to get exposed to the new environment and rest yourself. That will prevent the development of acute mountain sickness. You may ask, sir, is it possible to habitat at the high altitude? Yes, definitely it is possible to habitat at high altitude. So then what is the height at which we can habitat? That height we discuss in the next lecture, that is the acclimatization to high altitude.